Good evening, everyone. I'm Dr. Sarah Mustafa from DentistChannel.Online. Welcome to today's webinar about oral manifestation of hematological disorders reported cases. While we are waiting for the participants to join the session, I will introduce you to our company. DentistChannel.Online is a digital dental media company. It is your marketing solution for dental events, product launches, workshops, and courses. We also provide a collection of scientific articles and blogs about different topics in dentistry. We work hard to be your first-hand information on the technological advancements in the dental field. Now it's time to start the session about oral manifestation of hematological disorders, reported cases. If you have any question about this topic, please feel free to ask it in the question and answer box, and we will answer each and every question at the end of the session. I will start by introducing today's session speaker, Dr. Muhassad Al-Mudaffar. Dr. Muhassad got his BDS from Babel University in 2008. After that, he did a master's degree in oral medicine at Baghdad University in 2012. In 2017, he got a PhD in oral medicine from the same university. He has many published researches. Welcome, Dr. Muhassad Al-Mudaffar. It's our pleasure to have you with us.
Thank you, Dr. Sarah, and for this nice presentation and introduction, and all participants and dentists join this webinar. Thank you for joining this webinar. I will talk about in simple words and simple notice about oral manifestation of hematological disorder. I am Dr. Muhassad Al-Mudaffar, Assistant Prof in Kufa University College of Dentistry, Head of Oral Diagnosis Department, and talk about in simple notes about introduction about hematological disorder and why dentists study the hematology in different specialty, dentistry and hematology. Each dentist, I talk with GP dentist, the general dentist, not specialty of dentistry. From GB and or just baccalaureate. This deal with hematological disorder and deal with hematological manifestation in oral cavity. And oral cavity is a mirror of the body. Mirror of the body can early diagnosis of such complication of hematology and like disease of blood frequently affected soft and hard tissue of the mouth in different characteristics as hard swelling, as oral ulcer. This can easily detected by any dentist, and just I talk about only in simple lab investigation like complete blood count, blood film. Just complete blood count and the blood film can discover and early diagnose the hematological disorder and other systemic disorder, but today I talk about only hematological disorder. And lab investigation and stated in this lecture and showed the important role of the lab investigation in dentistry and or in discovering this disease and consider the lab investigation as a cornerstone in accurate diagnosis. A classification of disease of blood can classified as follows: cellular defect, coagulation defect. Meaning that cells of blood defect or coagulation defect كالintrinsic والextrinsic factor and cellular defect meaning RBC, white BC, platelet defect. In simple, I talk about only cellular defect in this webinar. Cellular defect like RBC اللي هو red blood cell erythrocyte. Erythrocyte, if increased, called polycythemia. If decreased, called anemia. Anemia is not a disease, but manifestation of other cause, and anemia are signs, symptoms of other disease. Iron deficiency, like iron deficiency anemia, pernicious anemia, aplastic anemia, thalassemia, sickle cell anemia. If defect in white BC leukocyte, if increase the leukocyte, called leukocytosis. The simple definition in hematology, only simple definition of hematology. Pathological leukemia, infectious mononucleosis, if decreased due to destruction, due to bleeding, due to autoimmune, due to malignancy, leading to leukopenia and neutropenia. If a thrombocyte increased, called thrombocytosis, decreased thrombocytopenia purpura due to autoimmune disease, the same causes. Destruction of cell due to cytotoxic drug, or infiltration of malignant cell to bone marrow, or bleeding, or autoimmune disease. Beginning with cases. حتى يكون عندنا clinical, in Arabic clinical cases. Case number 1. 58-year-old patient complaining of gingival enlargement since 10 days ago. Medical history known, هو yellowish patient, can lab investigation only complete blood count and blood film. This rule of complete blood count and blood film in diagnosis of this case. This case, gingival enlargement, generalized gingival enlargement, yellowish patient, fever and weakness, feel weakness, were 10 days ago gingival enlargement. Blood film, only blood film discover all this complication. Blood film appear the monocyte atypia and monocyte hyperchromatic bizarre shape monocyte and immature pre-monocyte and monocytic immature. الآن ماكو maturity بالمونوسايت إذا لاحظها وأنا راح أشر عليها. immature monocyte. هذه called blast cell. Blast cell 59%. 59%. If increased 95 blast cell, called chronic. 30% to 60% called acute phase. For this monocytic cells, 17% RPC normochromic, normocytic with teardrops RPC. Leukocytosis, هنا نشوف increase of a granulocyte formation, increase of granulocyte and increase of monocytic cell. Immature blast cell, bizarre shape, hyperchromatic. This conclusion of acute myeloid leukemia with monocytic differentiation. And this initial diagnosis and early diagnosis of this case done by the dentist. Initial diagnosis by the dentist and referred to oncologist for chemotherapy and drugs. Case number 2. 65 years patient complaining of recurrent oral ulcer, just recurrent oral ulcer. Yellowish face, lab investigation, complete blood count, and the blood film. I talk about the cornerstone in hematology or in this simple lab investigation, but important in dentist, in each dentist. Each dentist sends the patient, if abnormal patient, yellowish patient, patient with oral ulcer, a patient with systemic disease, to complete the blood count and the blood film. This patient with white BC count 22,000 platelet decreased وhemoglobin decreased, RPC normocytic, normochromic, normocytic. يعني normal cell with normal chroma of RPC. White BC leukopenia and severe neutropenia. This conclusion with pancytopenia. This patient with pancytopenia and sent to hematologist, maybe this patient with aplastic anemia or other defect cause defect in production of leukocyte. Leukocyte defect in bone marrow. This need for bone marrow aspiration and histopathology aspiration show the bone marrow if defect in production of, and this referred to hematologist. But the cause of this recurrent ulcer cause pancytopenia. Also, case number 3, 60 years patient complaining also of recurrent oral ulcer. Lab investigation, complete blood count and blood film. Should be this notice about lab investigation, complete blood count and the blood film. Only the rule of complete blood count and the blood film in early diagnosis. This patient with recurrent oral ulcer, complete blood count 4,000 white PC. This patient with mild neutropenia, this patient should be sent to serum protein, electrophoresis, and bone marrow aspiration because of this patient to excluded of the multiple myeloma and plasma cell malignancy. This and sent to hematologist and confirmed this patient with multiple myeloma and initial diagnosis. This initial diagnosis by dentist, oral cavity, mirror of the body, and each dentist can have or has a rule in initial diagnosis. I talk also about pernicious anemia. Pernicious anemia is a part of megaloblastic anemia. Megaloblastic anemia due to deficiency of B12 and RBC, macrocytic RBC, and hyperchromic immature chroma. For this due to deficiency of vitamin B12, also have vitamin B12 deficiency related megaloblastic anemia in alcoholism, liver patient, thyrotoxicosis patient, this patient with cytotoxic drug malignancy, patient with megaloblastic anemia, but not related to vitamin B12 deficiency. If megaloblastic anemia related to B12 deficiency, part of this deficiency called pernicious anemia, if autoimmune patient will have antibody against intrinsic factor in the stomach, intrinsic factor in the stomach, we have rules in absorption and entrance of B12 to the body, intrinsic factor as a mucoprotein necessary of absorption of vitamin B12. This defect of intrinsic factor may be called due to autoimmune disease, like patient with rheumatoid arthritis, patient with associated with patient maybe with thyrotoxicosis, rheumatoid arthritis, patient with a blue eye. Also, a patient undergo to sleeve surgery, is it? Cause also defect in intrinsic factor. This pernicious anemia, but megaloblastic anemia, deficiency of B12 may be due to malabsorption beginning from gastric pernicious anemia, beginning from intestine due to worm tape, like worm tape, other malignancy and GIT and surgery, defect in absorption, defect in inadequate diet, like in vegetarian patient, also complaining from vitamin B12 deficiency, like in this case. Case number 4, 50 years old patient complaining of a smooth tongue, glossitis or glossodinia, allergic tongue, yellowish and burning sensation of the burning mouth syndrome, and burning in the hand, in peripheral nervous system neuropathy, complete blood count and blood B12 level, and intrinsic factor antibody, because the patient complained from other autoimmune disease, and serum ferritin. The result, intrinsic factor antibody positive, vitamins B12 low, the 50, very severe low. Should be this patient need for vitamin B12 replacement in 7 injection ampoules in 1 week, and each 3 days ampoule, and after that each month 1 ampoule with recurrent lab investigation to elevate the B12 and patient cure from burning tongue. Serum ferritin also low, and after replacement of B12, the patient referred also to hematologist for other consultation. Case number 5, 70 years patient complaining of a smooth burning tongue, also complete blood count and B12 level. The result, this patient vegetarian. This patient no meat and B12 in the meat, also in vegetable, but vegetarians like to be inadequate diet, the cause of this vitamin B12 deficiency. Also, after replacement, the patient each month take B12 and burning cure and a healthy tongue. Aplastic anemia. Aplastic anemia, it occurs due to failure of hematopoietic precursor cell. The progenitor, the stem cell progenitor, failed to produce adequate number of blood cells, failed in produce megakaryocyte, failed in produce granulocyte, failed to produce a granulocyte, failed in white PC and RBC. This aplastic anemia. Aplastic oral manifestation, pallor oral mucosa, submucosal ecchymosis, gingival bleeding, oral candidiasis, gingival hyperplasia. This oral manifestation of aplastic anemia or ulcer covered with black or gray necrotic membrane. This case in number 6, 70 years patient complaining of recurrent oral ulcer, smooth burning tongue, yellowish face. This patient here previously diagnosed aplastic anemia, not initial diagnosed by dentist, but this patient for consultation about oral ulcer only. Doctor sent him about the consultation, the oral ulcer in the tongue, in the lateral border and in the ventral surface of the tongue. This necrotic membrane around this ulcer in the middle of the ulcer, necrotic tissue, due to maybe a sharp edge or trauma. But this patient, but I talk about the aplastic anemia and oral manifestation. Also, other cases of thalassemia also here previously diagnosed by hematologist and referred to for consultation. This Mediterranean anemia, erythroplastic anemia, occurs when the partial or complete failure to synthesis specific type of globin chain have hemoglobin, heme and globin, globin chain, beta globin, alpha globin. Defect in beta globin must come in alpha globin يعني defect يكون اللي هي الالفا ثلاسيميا يكون less than common beta thalassemia. In oral manifestation, excessive overgrowth of the maxilla, excessive lacrimation, and nasal stiffness, pallor oral mucosa, and rodent faces, chipmunk faces. This like this case number 7, 10 years patient, previously diagnosed with beta thalassemia and complaining of a huge gingival growth and mobile teeth and severe open bite. Like this 10 years old patient, severe open bite and enlargement of maxilla, enlargement of maxilla, lacrimation, nasal stiffness, mobile teeth, gingival growth. Sickle cell anemia, other cases also diagnosed from previously and referred to يعني referred for يعني consultation on only about sickle cell anemia and oral manifestation. It occurred due to gene mutation. This thalassaemic and sickle due to gene mutation. Oral manifestation, pallor oral mucosa, also gingival enlargement, orofacial pain, paresthesia of mental nerve due to occlusion, vascular occlusion caused osteomyelitis or infection, gingival also delay eruption, enamel hypoplasia, asymptomatic pulpal necrosis, severe malocclusion, يعني radiographic features, bone marrow hyperplasia, expanded slight expansion or expansion due to bone marrow hyperplasia, due to hemoglobin S, RBC occlusion can occluded the blood vessel, causes severe pain. Like in case number 8, 25-old patient complaining of sickle cell anemia, previously diagnosed, came with mandibular paresthesia. This lower chin mandible with paresthesia and slight expansion of the jawbone and gingival inflammation in this picture. This picture slightly expanded of the mandible, bone slightly expansion, gingival inflammation with paresthesia of the mandible. In CBCT showed that or stated expanded of trabeculae due to expansion of bone marrow growth to produce RBC, but defected RBC with the hemoglobin S or trade of hemoglobin S. This expanded in the lower and maxilla appear in this CBCT. This stated expansion expansion of the trabeculae expanded وهنا also in the maxilla expanded. Therefore this patient risk or vascular occlusion and vascular and osteomyelitis of the jaw. Therefore treated this patient with with the nucleo CMP40 and nucleo CMP40 methicopal injection والgabapentin or Lyrica and returned to the hematologist to take the medication to prevent occlusion of the blood vessel. The most common deficiency of the anemia, iron deficiency anemia. Iron more common in female due to physiology, pregnancy, menstrual cycle is mainly caused due to inadequate intake, absorption, inadequate intake, or malabsorption, an increased requirement due to pregnancy, an increased loss, bleeding, and gastrotomy. Oral manifestation, mucosal pallor, atrophic mucosa, angular cheilitis, glossitis, migratory glossitis, candidal infection, dehydration and ulceration due to atrophy of mucosa are the main oral manifestation of oral iron deficiency anemia. Like in this case, a 35 years patient complaining of oral ulcer, also lab investigation, complete blood count and blood film. Any dentist can complete blood count and blood film. This oral ulcer, complete blood count and blood film show the hypochromic cell of RBC microcytic, small, and hypochromic without chromia, pencil in shape, white BC normal count, platelet with normal count. This iron deficiency or thalassemia, and send him the patient to a store of serum ferritin and serum iron, and send the patient total iron binding capacity to differentiate between thalassemia. If iron deficiency anemia, total iron binding capacity elevated. If thalassemia, normal or decreased. And case number 10, 40 years patient complaining of recurrent oral ulcer, also lab investigation, complete blood count and blood film. Complete blood count can this patient with iron deficiency, anemia, hypochromatic and microcytic, and just oral ulcer. Thank you for all dentists join this webinar, and thank you for this channel. Thank you, Dr. Sarah.
Thank you, Dr. Muhassad Al-Mudaffar. It was a pleasure having you on our platform. I would like to thank you for this informative session. Meanwhile, I'll ask your permission to introduce our company to all the participants, and I request all the participants to kindly put their questions in the question and answer box, and we will answer each and every question at the end of the session. This is our organization, DentistChannel.Online, Healthy Smiles, Wealthy Lives. DentistChannel.Online is India's first digital dental media company. We did webinars and courses with more than 400 national and international speakers, many successful world implant expos, online workshops, and dental webinars. If you're not a Prime member yet, kindly join our family to get free certificate of participation after every event and get exclusive offers and discounts on our online and on-site paid workshops and courses. Prime members will be awarded with 1 CPD CE point for each free webinar. You can use my code SAR100 in order to benefit from a discount. This is an example of the certificate of participation that you will get after every event. About our upcoming webinars, on June 26, we have a webinar with Dr. Aswin about comprehensive clinical aspects in diagnosis and management of oral cavity and head and neck cancers. On July 3, we have a session with Dr. Jasdeep about study options for foreign graduation in United States and Canada. I request all the participants to kindly save this number and then send a message on WhatsApp with their name, so they will be added to our broadcast list and they will receive everything about our upcoming dental webinars and courses. Today's webinar is sponsored by NovaMind. NovaMind offers a full spectrum of implants and prosthetic solutions that accommodate any clinical need in modern implantology. We successfully supply highly demanded dental implants types called internal hex, tissue level, bone level, and active conical connection. Our EU production unit and product quality is appreciated worldwide. Dental implants and dental restorative solutions produced maintaining all the standards of EU medical device regulatory. Products are manufactured in Athens, Greece, and distributed worldwide with more than 1 million happy restorations. If you want to know more about NovaMind, kindly check their website. And last but not least, don't forget to follow us on our social media platforms, Facebook, Instagram, and YouTube. So now, doctor, I'm checking, but it seems that we don't have any question. Everything was clear. I would like to thank you so much, Dr. Muhassad Al-Mudaffar, for this informative session. It was a pleasure having you on our platform.
Shukran. Thank you, Dr. Sarah. And thank you all participants joined this and dentists joined this webinar. And thank you for channel for other lecture, inshallah.
Inshallah, we are looking forward to organizing more lectures with you in the future, inshallah, dear doctor.
Inshallah.
Thank you, everyone, for joining us tonight. Have a good night, everyone.